Hey everyone, I am your fave Nurse B. Thanks for coming back to my channel. If you are new here, consider subscribing. I have plenty of videos for aspiring nurses, nursing students, new nurses, old nurses, anyone who wants to get into the healthcare field. This channel is for you. So I do want to preface this by saying the careers that I'm going to go over in this video are careers that do not require a lot of schooling. So what I mean by that is less than a year. Some of them require a year, some of them a little bit over a year, but definitely less than 2 years of schooling. For the most part, most of them are like 6 to 8 months of schooling. If there is a career that you know of that requires less schooling but is not on this list, then you might want to check out my other video, which is the top 6 healthcare careers that besides nursing that pay more than $50K a year. And then I also have a video talking about healthcare careers you can get into that require little to no patient care, direct patient care, I should say. So those videos might talk about other healthcare careers that you're like should be on this list. So go check those out. They're really, really helpful if you want to get into healthcare and you just want to kind of get a feel for it and you might not want to go for nursing. There's so many options out here. That's why I do these videos for you all. So please go check them out. Please support the channel. Like, comment, subscribe, and share. All right, you all, as a disclaimer, please make sure that you go out and do your own independent research for each of these careers based on the area that you're in. You want to make sure that whatever you decide to go into, there is a demand for that career in your specific area, as well as look up how much these careers are paying in your specific area. I'm just giving you all an overview of it based on my knowledge and my own research. And also share my videos. Thank you all so much. I hope you enjoyed this list. If you want to add to it, put it in the comment section. If you want to clarify anything that I said or correct anything that I said in the video, put in the comment section. I'm down to learn just like you all. So go ahead and comment down below. It really, really helps my channel. And press that like button. Go ahead and subscribe. Thank you all so much for watching. Let's get into the video. The first career out there that requires less than a year of schooling in healthcare is a community health worker. They do a lot, and I think it's really, really cool. A big part of what they do is community outreach. They are basically like the middle person between the healthcare system, so any type of services out there, programs out there for people, and actual people out here in the field who need help. They are the ones who bridge those two worlds together. This is really, really awesome if you're a type of person who can communicate really well, you can make those quick connections to people, or you already are a part of a community that needs more attention or who needs to have someone to help them to navigate through the healthcare arena. So say for example, you are from Malaysia, okay, and you speak the language and there's a Malaysian population in your area. You speak the language, you understand the culture, you're there, and you want to become a community health worker. Say there's programs out here for people who, you know, are not from the US, or just community programs or health programs in general. You can be that middle person to connect programs to that community because you already understand the community, the culture, the language. They trust you. And you can understand, okay, what do they need? What does my community need? And you connect them with different programs out there for them. It's really, really cool, especially if you want to work with minorities, like I said, if you want to work with people who are in a lower socioeconomic status, or just people, even elderly patients. You just want to work with people who may kind of slip through the cracks of healthcare. You are that person to help them to be reconnected with the services that they need. I think this is like awesome. This is awesome for anybody who likes to get out there in the community, talk to people, help people. You have to have amazing communication skills, and you have to be able to build relationships with people pretty quickly because you're kind of coming into people's homes, seeing what they need. You might host like some type of community health drive in your area, and you're basically out there in the grassroots of it all, helping people on the front line and connecting them with services. Somebody comes to you, maybe it's a teenage mom, and you say, you know what, I know a program that helps teenage moms be able to get health care for their child while they go to school and get their GED, or they go and they get their high school diploma, whatever. You can connect them with those services, but you have to be really good at making connections with people and having good relationships and rapport with people, because you're going to be dealing with all these different healthcare facilities and programs, and also people as well. So you want to make sure you have good communication skills and make sure that you're able to build relationships, because you don't want to have a falling out with a program and there's people out here that need that program. You get what I'm saying? And you also need to be able to advocate for people. So I think this is really, really cool. On average, they make $36,000 a year, which is around $19 an hour. And then the salary ranges from $31,000 to $42,000. So that's about $16 an hour to $22 an hour. Sorry. And from what I can see here in St. Louis, there's a workforce program that will pay for you to be able to do it. It just depends on your income, but it's a 12-week program and the cost is $1,800. So that's pretty affordable to me. And I think this is really good for anybody who wants to get out there and help support the community and connect them with the healthcare that they need. And this is so important nowadays because, you know, America is becoming more and more mixed, and people, sometimes they might not feel comfortable going to the doctor telling them what issues they have, especially certain women who come from certain cultures. They might not feel comfortable being in the healthcare system, or just certain cultures in general may not feel comfortable with the healthcare system that we have here in the US. And so many people fall through the cracks. So you, as a community health worker, are able to bridge the gap, if you will. Just know that this title goes by many names, and I'll have them listed here, but there's many names for this title. Community health worker, just know that when you're looking for jobs. All right, so number 2 are EMT, or emergency medical technicians. So EMTs, we pretty much know what they do. They're the ones who are in the ambulance, and they go to the did I say ambulance? I used to say ambulance. Ambulance. They're in there and they're the ones, again, on the front line. They get to the emergency scene before anyone else. They're the first ones to see the patients, and they basically get them stable enough to transfer them to the hospital. That's what they do. This is really, really good for anybody who is, you like that adrenaline, you like that rush. You can come in, you can make a quick assessment, get things done. You like to just have that energy going about you. And you have to just be sharp. You have to be sharp to do this. There's also communication as well, because you're going to be talking with other healthcare professionals. You have to be able to assess the situation, see what's going on, and then communicate that to the hospital when you go to the hospital, or to the nursing home when you go there. You need to be able to make those, be able to communicate with people. I think with all these you need to, but I've come across some EMTs that's rude, honey. They don't care. They just mean. But for the most part, I've come across some really, really cool EMTs. This is also good for men. I know healthcare sometimes can be more female-based, especially like with nursing, of course. But EMTs, it kind of fits men as far as, like, you know, they like that aggression. They like that that rush and everything. And I see a lot of male EMTs. I see a lot of female EMTs as well. But I do feel like this fits men too. I don't know if that's politically correct, but I do feel like this is a good placement for men in healthcare. So from what I've seen, the average is $36,000 a year, which is about $19 an hour. And then it ranges between $32,000 to $40,000 a year, which is $17 an hour to $21 an hour. Now in my area, I believe it was through the community college. The tuition was about $1,300, plus you had to pay for a textbook and a lab fee. And that included anywhere from 5 to 6 months of schooling. And you could get approval through the WIA program, WIOA program, to help pay for it based on your income. And I do know someone, he was a CNA, and he went to school to become a paramedic. Now, one of the things he told me is like the test out of it, I think he had to leave where we're at in St. Louis. Like, you had to go, I think, to San Antonio and take the test. Like there was like certain places you had to go to take your final test, and you like walk in, it's like an emergency situation. It's like a mock emergency situation, and you like there's somebody on the floor and there's stuff happening. You have to basically say like what you're doing to them and how you're doing everything. So it takes skill. It takes like that sharp energy. If you like that adrenaline rush, this could really fit you. I do want to also add that EMTs, like they make a huge difference in healthcare, like I said, because they're the first ones more than likely to see the patient. They get them stable so they can transport them to the hospital. So these people, like they're very, very much in demand. Now don't get me wrong, sometimes it could just be boring, like somebody calls you because they fell on the floor and they want you to come pick them up. Like that's not an emergency. I mean, to them it's an emergency, but sometimes you're like, I can't, you're abusing this. Or you have to go to a nursing home and pick up somebody because they're refusing patient care and they want to go to the hospital, and the staff there is like, we don't want to send them out, but the family wants them to leave, so they're leaving. And it's just like, sometimes it can be humdrum, but really you all make a huge difference in healthcare. So EMTs. All right, number 3 is medical assistants. I did a little research. I had someone reach out to me on Facebook. They gave me some tips about what medical assistants do. Just in my experience, when I was pregnant with both my daughters, I always dealt with a medical assistant. So at the OB office, I would go in, they would take my information, ask me if I'm in pain, get my vital signs, and basically if there was any procedure that needed to be done in the actual OB office, they would prepare that for the MD, and then that's that. They explain medical procedures to patients. They assist the doctor during examinations. They collect lab specimens. So they also might sterilize medical instruments. So it seems like they do a lot, and that, yeah, they seem like they do a lot of work. She told me also, like, part of their training is they have to learn how to do x-rays, which I had no idea. Of course, you need to learn how to do vital signs, and there might be other procedures they have to learn how to do in that actual setting. So the average pay is $35,000 a year, which is around $18 an hour, about $18.50 an hour, and then the range is between $32,000 and $38,000 a year. That goes excuse me, that goes from about $17 an hour to $20 an hour. And then the education I found was about 32 weeks, which is 8 months of schooling. So in the school I saw was only $2,000. My LPN program was $17,000. So yeah, that's a big difference too. I just want to add this, that I have come across a lot of people who have gone to school for medical assisting and have not been able to find jobs. Yet when I go to doctor's offices, I always work with medical assistants. So I don't know what it is, but definitely look in your area to make sure there's actually a demand for this. Do your research. You don't want to go to school for something to pay the money for and you can't find a job afterwards. So do the research. There is a difference between LPNs and medical assistants, and if you are a medical assistant or know someone who might want to do a video collab with me, let me know, and that'd be a perfect freaking video to do. So let me know. You can email me, Brandy at YourFavNurseB.com. All right, y'all. Next we have is EKG tech. They perform the electrocardiograms on patients. So anytime you've ever seen someone put those like plastic leads on a patient and they hook them up to a machine and they see what the function of the heart is, that more than likely was an EKG tech or someone who was trained to do this actual procedure. They can do this before a surgery is being done or just as a routine lab that needs to be done. And I believe I've seen EKG techs, they usually either work in the hospital or in clinics. So you are going to be working with equipment and patients. So you need to be good at doing both of those. As far as wage, it's $38,000 a year. And then the range is between $33,000 and $44,000 a year. As far as education, I saw some programs that are about 10 weeks long, so under 3 months, and the price was $1,200 for the program. So for that price of a program, I feel like that's a really good amount of money to make. Next on our list, number 6, is a phlebotomist. Phlebotomists, basically what they do is they take the blood from the patient and keep it pushing. They'll take the blood from you. You more than likely have seen a phlebotomist, especially if you've ever had a child. You've definitely seen a phlebotomist. The phlebotomist can work in hospitals, clinics, and I know someone, he does phlebotomy, and he actually worked he did mobile phlebotomy. So they would come to the nursing homes, of course, take the blood from the patient and then take it back to the lab And then also he did it where he would go to certain people's homes and do lab work there, well, blood work there, and take it to the lab for it to be tested. I'll say the biggest thing with this is being good with patients, because you're taking their blood, and a lot of people don't want that to be done. So just having that patience of dealing with people, talking to them, calming them down, being able to actually collect the blood, and then knowing which test you're taking, because some tests you have to run it through this thing in your car that like shakes the blood around. I know it sounds crazy. I don't know the name of it, but they have to do that. Or some stuff you have to do before a person eats. So it's, of course, you know, remembering what the tests are and what the procedures are for actually collecting the blood, and then also communicating to the staff in the area that you're in. And a lot of times with phlebotomists, you have to be able to work quickly to get the blood, keep it pushing, because like I said, some people don't want it to be done. Some people are major wusses when it comes to collecting blood. Like, they hate for you to come take their blood. They hate the needle. They're crying, they're screaming the whole time. Grown folks doing it. I know, baby. So just keep that in mind. So you have to somewhat, I know, you have to somewhat be good with people. She is not happy. So the wage I saw was on average $34,000 a year, which is around $16 an hour. And then the range was between $31,000 and $38,000 a year. So that leads us to $16 an hour to $20 an hour. So the programs I saw was, again, 10 weeks for $1,200. So less than 3 months, and you could be making about $18 an hour, $16 an hour. Like, that's good. Only thing is, I have seen that some people, when I talked to phlebotomists back in the day, they told me that it might be a little hard to get your first job because they want you to have experience. So just keep that in mind. But it is an option. The next is a CNA. Now, of course, I started off as a CNA. This is, of course, a given. Most people know what CNAs are, but you might not know. So it's a certified nursing assistant. You assist the nurse by helping patients with their ADL, so activities of daily living. You do bathing, cleaning, changing the patients, feeding the patients, straightening up their rooms, transferring patients from the bed to the chair, from the chair to the couch, to whatever. You're basically just helping that patient do what they do on a daily basis. They have plenty of videos about CNAs, and I even have a CNA playlist, to go check it out. But I started off as a CNA. To me, it's a great way to get started into the healthcare field. It's a pretty quick and expensive way to start. And the average pay, I didn't do the salary for a year. I just went over the hours. That's what mostly I could find. The average salary is $15 an hour, and it ranges between $14 to $17 an hour. That's what I found. But to be honest, when I started off as a CNA, I was making like $8 an hour. I was an NA, which is a nursing assistant. So there's a difference between nursing assistant and certified nursing assistant. Do you see the difference? Is the certification what helps you to make a little bit more money versus just being an NA. And NAs can only work like home health. They can't do nursing homes. So on average, once I was NA, I was making $8 an hour. Then when I became a CNA, I was making $10 an hour. Granted, this was back like in 2011, so 2012. So I think the pay in the area that I was working in went up to about $11 an hour. So it could be lower than 14 on average. I would say the low end. Around the board is probably like the lowest you might get paid is about $10 an hour going up. Now, of course, there's different ways to make more money as a CNA. You can do agency work. You can work PRN and make a little bit more. You can do weekends, options, and make a little bit more. So there's ways to make a little bit more as a CNA. But I think it's a great way to start. It's definitely not for everyone because you are on the front line. Like, you're dealing with feces and fluids and attitudes and screaming and racism and people spitting on you, cutting on you, trying to just ruin your whole life. But there is some rewards to it, so I'm not going to completely knock it. I love CNAs. I feel like CNAs, like, they make or break a nursing home. So that's that. You can also do home health as a CNA. And the schooling is typically about 16 weeks, and it's about $1,200 here in my area. Now, some places will take you in, like where I worked at, I got my training there, and they pay for the schooling. They pay for me to take my state board or certification. They pay for that to test out and get certified. They pay for all that. So definitely look and see if there's nursing homes in your area that will pay for it. And then there's also something called Slates that will pay for CNA programs as well. So the next career for you all is patient care tech. Now, patient care techs are similar to CNAs, but they do a little bit more. They work in hospitals. They can take blood. Some of them can take blood. They can do catheters. So in some areas, patient care techs can give enemas. Like, they can do a lot more than a CNA, and they work in the hospital. It's more of, I would say, a little bit more professional, because you're dealing more with doctors on a daily basis. And from what I've known, patient care techs, not a lot of them do, like, they don't always work with geriatric patients, because, you know, in a hospital you can do pediatric patient care tech, which I do have an interview with someone I did, my bestie. So go check that out. Yeah, this child. And then similar to CNA, most hospitals will pay for you to become a patient care tech. It takes a little minute to get into hospitals. You should apply to more than one. It's a little bit more competitive. If I was able to redo some things, I would have definitely became a patient care tech right after becoming a CNA and doing that, because you're in the hospital setting, you're learning a lot, you're seeing a lot, and it's just a little bit more professional. And hospitals will help for you to pay, for school. A lot of nursing homes will too, but you're already in the hospital. You might want to come back and work at that hospital. So that's always a good reason to get into becoming a patient care tech, because you're already in the hospital, and it's easier for you to get into the hospital again as a nurse. Just be professional and be on top of things if you want to come back and work at that facility. Y'all, this child. All right, as far as pay, patient care techs on average make $32,000 a year, so about $17 an hour. And then the range is between $27,000 to $41,000, so about $14 an hour to $21 an hour in some areas, yes. And then the training I saw was for 32 weeks for $2,000 for that training. But once again, a lot of hospitals will pay for you to go. Next is a dialysis patient care tech, or dialysis tech. So what they do is they dialyze a patient who basically they're in end-stage renal failure. They need someone to basically take the blood out of their body, clean the blood, filter it out, put it back in their body. That's what dialysis basically does in a nutshell. They usually work at clinics. They can work in hospitals. They get paid a decent amount of money. So on average, they're getting paid $40,000 a year, which is $21 an hour. And then the range is between $35,000 to $45,000, so $18 an hour to $23 an hour. That's really good to be a dialysis tech. I think that's really good money. So as far as the education, I was kind of finding some stuff, and then it was kind of off. I couldn't really tell specifically, like, I didn't get any like concrete time frame, but what I could find is anywhere between 1 to 2 years of schooling. So one place even said 6 months. So it really depends on your area and where you're working. And just know, if you get hired at a place like Fresenius or DaVita Dialysis, they can take you on and they'll train you, and you are basically hired contingent on you passing the state exams to become a dialysis tech. They pretty much do everything. They bring the patient in, they hook them up, they monitor their vital signs, all that jazz. And the nurse on duty just kind of like monitors everything and supervises everybody. But the dialysis tech basically do the work. So you cannot be freaked out about blood, because that's literally what you're going to be seeing all day long. And you have to be able to talk to people, because some people, they're grumpy, they don't want to come there. They're there, this is their life. Dialysis is their life. Sometimes they come 3 times a week, sometimes they come 5 times a week, and they come early in the morning. Now I know some people, they go a little bit later in the day, but more than likely they're going to be coming early, like 4 o'clock, 5 o'clock in the morning. So you have to be a person who's very timely. You can't be calling off every other day, coming into work every other day, because dialysis is how these people live. Okay, this is their life. So you really are important. Your presence is important. Your timeliness is super important as a dialysis tech. So keep that in mind. It's a very serious type of job. I think, you know, you make a difference in somebody's life. So with all these you do, but y'all get what I'm saying. So just keep that in mind. But it is good pay. It's you can travel a lot with this job. You can travel with all of these jobs, but there's plenty of people out here that need to get dialysis. So I think there's a lot of job security. So yeah, that's that. Right, so number 9 on our list is a CMT, a certified medical tech. CMTs, they win it now. CMTs, they don't do direct and patient care. They're not doing bed baths and dealing with fluids and all that jazz. They're basically giving medications. That's what they do all day, every day. Not to say that it's not hard, because if you're giving meds to 30, 40, 50, 60 people and you're the only one doing it, you're doing scheduled meds, PRNs, especially when you work in the geriatric population. Some people take 20 pills in one pass, plus they take an inhaler, 2 inhalers, plus they got to take a breathing treatment, plus you got to wait a certain amount of minutes, do their eye drops, 3 different eye drops. You got to wait. You have to wait in between the eye drops. So it could be, or what pill is this? It could be a mess. And I do have actually a playlist. I have a playlist for CMTs as well, so go check that out. I told you I got something for everybody. On average, the pay is $31,000 a year, so about $16 an hour. Range is between $28,000 to $33,000 a year, so about $15 an hour to $17 an hour. As far as schooling, I'll put the info here because I still need to find the info, but I found a lot of programs, like if you're working in a facility and they need CMTs, they might train you and pay for you to be able to become a CMT. And then also the SLATE program here in St. Louis, they offer it as well, and you get government funding to be able to do it. And also, just so you know, just know that most states, or at least here in St. Louis, Missouri, you are required to be a CNA for at least 6 months before you can go on and become a CMT. And also know that some jobs might hire you as a CMT, but they'll have you work as a CNA. So just keep that in mind. I know a lot of CMTs have that issue where they got hired as a CMT. They don't want to work as a CNA, but they might put you on the floor and work you as a CNA. So just keep that in mind. Alright, so that's that. That's our list. The top 9 careers you can get into in healthcare that do not require a lot of schooling. I do want to add an honorable mention, which is LPN. I am an LPN. I know you're like, wait, this is not supposed to be nursing, but I just wanted people to know, in case you do not know, LPNs typically take about 12 months to do, 12 to 18 months depending on the program in the area. Usually it's through a tech school, and you can become a nurse. You can make, here in St. Louis, I think the average pay for LPNs is about $20 to $21 an hour. Some areas you're making, you know, way more than that. If you work agency, you can make about $30 an hour, $28 an hour. Plus, of course, you know, shift differentials and working PRN can help you to make more money. And so that's 12 months of your life, and you're going to be making a decent amount of money. So definitely look into that. Who is staring at me? Is he staring at me? So yeah, look at that. But I did want to just put that on there. The national average is $47,000 a year, which is about $22 an hour. And that's a great way to get into healthcare and see if nursing is for you or see if healthcare is for you. But it is a commitment. Nursing school, just because it's LPN does not mean that it's going to be easy. But it takes some work, trust me, it does. But that's just an option out there for you all that's less schooling, and you can be a nurse. So let me know if you all found this video helpful. I know it's a little bit all over the place, but go check out the other 2 videos that I mentioned. Like, comment, and subscribe. Share my channel. Let me know what other type of videos you all want to see as far as me highlighting different careers. And if you know anything that I missed out on, or you want to go into more detail about, put it in the comment section for me, you all. Check out my website, YourFavNurseB.com. Also, check me out on Instagram at YourFavNurseB1, and join the Fave Nurse B Facebook group. I will have everything linked down below. I'm burning up. This child is... she's heavy, y'all. Yeah, that's that. Also, go check out my website if you haven't already. If you are planning on going to nursing school, I have nursing school notes up for sale, as well as study templates for you all. All right, I gotta go. Peace. Thanks for watching.